Hi, good evening, everyone. As you may know, my name is Dr. Betty Teh. I'm the founder of Beating Hearts, and I have here Dr. Teh Jo Hun. He's actually my cousin from my mother's side, my maternal cousin, and he holds a PhD in public health. Today, I think more so than any time in our lifetime, we have never seen public health being so important in our medical history, especially with this pandemic ongoing. And public health now plays a very important role. So maybe without further ado, we get Dr. Teh Jo Hun to give us the talk. Hi, Amu. Okay, Johan, go ahead.
Okay, thank you, Betty. Let me just share my screen. Okay, can you all hear me? I sure.
Yeah, we can hear you
Okay,
really
I'm
well.
Dr. Teh, also.
Yes, obviously.
All right. Yeah, okay. As Betty mentioned, I'm a medical doctor as well, and I'm a public health physician. And in Malaysia, sometimes officially we are called public health medicine specialists, another term for public health physician. So today's short talk will be on the pathway to being a public health physician. We will start off, of course, with what is public health. Now, people are saying all sorts of things. Oh, public health now is in the forefront because of COVID-19. But there's more to that. COVID-19 is just one disease. There are many, many more diseases that public health is trying to reduce the burden of all these diseases. You can see here COVID-19 example. This is what we do in the field, swabbing for PCR in prisons, in Johor, in Sri Lanka. There's also at the Depot Tahanan Immigration. This was a big cluster among the immigration and also among these prisoners in Sabah, and also started in Kedah as well. So this is what we've been very actively doing.
Can I just ask a question at this present moment? How is it that the prisoner got the COVID-19?
You see, there are in Sabah, there are a lot of these immigrants coming in, and they were caught and put into these immigration detention centers.
I see.
And one of the policy is that during that time, we only do one swab for them before they go in. And some of them may be in still, pre-disease phase, like incubation phase. So they were not detected, and they went in and they became positive and contaminated the whole center. So that's probably how it started.
Thank you.
So what is public health? As I was saying, this Atchison says that public health is an art and science of preventing disease, prolonging life, and promoting health through the organized efforts of society. Of course, organized efforts in Malaysia would be mainly the Ministry of Health. So why is public health important? Not only for COVID-19, you can see here, throughout your life, from the time you were born until you die, the average length of stay of one person in the hospital is only 4.5 days out of your entire life of, let's say, 76 years. You only spend 4 to 5 days in hospital. And that 4 to 5 days lead to catastrophic health expenses sometimes, because it costs a lot of money. And it actually takes up 70% of our national health expenses. Even for KKM, our Ministry of Health budget, 60 to 70% of that budget goes to hospital care program. It's a large chunk for 4 to 5 days of your life. Whereas in public health, we're trying to keep you from getting sick. We have programs actually that actually cater for be pre-conception care, called pre-pregnancy care programs, right to programs that deal with the elderly care. So the whole life course, our KKM public health, we are going into a life course approach. We are looking at every point of your life where we can actually intervene and do a prevention. So why is public health important? Because focus on prevention and promotion will actually lead to reduce burden to the healthcare system over the long term, of course. So actually, public health is important in that respect. And our DG himself actually says that public health is best recognized and appreciated during crisis. And he himself says that we must invest more in public health and develop all the relevant specialty and subspecialty of public health. In fact, our DG says the best brains should be in public health.
This self-praise lah.
Prevention is better than cure. No, DG said it, not me.
Okay, echoing the DG. Okay.
Echoing the DG, yeah. So this is a screenshot of what the CDC's 10 essential public health services. I know to a young doctor, you see all these words, you get turned off. It sounds like an administrative thing.
Yes,
All
it
these
does.
big sounding words like assess and monitor equity, all these things, you get very turned off because it sounds very big words. But
Yes.
I'm going to put all these words in the context of COVID-19. You can see
Okay.
here, one of these top here in the red is actually assessment of population health. So in terms of COVID-19 as an example, assessment means surveillance and detection. To that, we have an established what we call influenza-like illness surveillance network throughout the whole Malaysia and all our clinics, and a notification system that is established already. That means if you detect a case of infectious disease, you are supposed to notify to the public health office. And now it's online. Every MO can key in online via this e-notice system. You have your password and you can key in immediately. You don't have to fill up the form anymore. If you detect notifiable disease under the CDC Act. So another example of this is investigate, diagnose. At the district health office, we actually have established teams called rapid response teams consisting of public health specialists, we call EPID officers or MOs trained in public health, environmental health officers, etc., that will investigate and initiate control measures like contact tracing, investigating how these cases develop, etc. So we have established teams at every district health officers, I think a total of 190 of them throughout Malaysia that have an established teams like this that will quickly go and do the contact tracing. So these are already an established system in place. We were ready before COVID-19 happened. And then for communication is our daily briefing, the education materials being prepared. And on the ground, we will do education to the public via our health education units at our district health office. Another example following that is strengthening of communities. We have this community education program, 3C, 3W. And then we create, champion, implement policies and plans. Of course, the SOPs, as you're all familiar with. Everybody is familiar with the term SOP now.
Yes. But
Even
the
though it
SOP
doesn't
changes so often.
Yeah, I know. 3 to 4% in the car. Yeah, that's a recent example. So another one is to utilize finally legal and regulatory actions. So this one is regarding the CDC Act 342 itself. It's still under development. We're going to make it more powerful. So you can do more for that. This already exists since 1988. It's called the CDC Act 342, 1988. This is where the public health specialist is the enforcer for this act in all our offices.
Oh.
Yeah, of course now it's being, police are also gazetted under this act for this EMCO Act. Before that, CDC Act was only enforced by public health specialists and our health inspectors under our Pejabat Kesihatan, the district health officers. So this act was under public health side for a long, long time before this. That's why if you fail to notify a case of infectious disease, sometimes the public health specialist will come and compound the MO or something like that if you fail to notify a case of infectious disease.
Even can they compound the public
Yes, yes, of course.
so they can fine us lah?
Yeah. Under
So
the
not-
EMCO
Okay.
compound is 1,000.
Yes,
For-
but it's not the
Yeah.
police that just the health officers can also fine us now.
Yes, of course.
Okay.
So public health in Malaysia is essentially any non-hospital based health programs or services that you can find. These are some of the examples that I've listed here. Of course, chief among them is the disease control, communicable and non-communicable disease. We have environmental health sanitation, international health, food safety, family health, where all our rural clinics and clinics outside the hospital are under this family health program. We have health legislation enforcement section, health facility licensing under your UCAPs and CCAPs, occupational health, health policy and planning at KKM level. And not forgetting also at local government, every local government, they have an environmental health and sanitation network. For example, garbage collection, dengue control, vector control. They also check restaurants for food quality and cleanliness, and road safety, of course. So these are all under the purview of the local government, but they also play a role in public health, not forgetting that. And some local governments do have public health specialists, they do employ them, but mostly they are handled by, in English, we call them assistant environmental health officers and environmental health officers. Previously, they were known as health inspectors. Now they call themselves assistant environmental health officers, or PKPs. Okay, so they are the health inspectors. They assist, actually their main role is environmental health and disease control. So these are some of the programs that are in Malaysia for public health section. And what are the roles of public health physicians? Okay, all public health programs, whether at national, state, or district level, are led by public health physicians. Public health, there are also some lecturers in university public health courses, and some are in local government. So you can see here this picture. Every time DG gives a press conference, right? There are 2 or 3 lieutenants, generals standing next to him.
Yes.
One of them is Dr. Rohaizat. He's also a public health physician. And then Dr. Chong. Dr. Chong is the deputy director of public health. And Dr. Nur Hayati. Dr. Nur Hayati, head of our disease control section. So they are all public health physicians.
I see.
So he's actually, DG is the face of the Ministry of Health, but he's aided by public health physicians in his role to combat COVID-19.
Yeah, because he himself is an endocrine surgeon.
Yes. So these are his generals who will assist him.
Okay.
So officially, public health physicians in Malaysia are public health medicine specialists. The nomenclature by JPA in Bahasa Malaysia is Pakar Perubatan. Same with other specialty. Before once you are a medical officer, you finish your specialty training, you'll be known as Pakar Perubatan or medical specialist. So in line with that, all public health specialists are known as public health medicine specialists.
Okay.
So that's just a nomenclature. And currently all district health officers or head of the district health office must be a public health medicine specialist, a public health physician.
I'm sure you're going to speak about what are the basic requirements to become.
Oh yes, later on.
Okay.
So at bigger districts, there's even 2 or 3 posts for public health medicine specialists in every district. In Cebu, for example, there are 2 posts for public health specialists. So before we go to the pathway, I'd like to just highlight in some photos what we do in the field. Of course, disease control, we lead the teams for contact tracing to confirm the cases. We do active case detection, and of course, to investigate the cases as they come. Okay, you can see this photo here, what we do. And then, in Malaysia, we actually have an established district health office system with contact tracers already in place. Our health inspectors are already there. Imagine in the US, they're trying to hire 1,000 contact tracers in Wisconsin just to do contact tracing. So it's very difficult for them. And we in Malaysia, we are lucky because we already have an established public health system that can be mobilized to do contact tracing already there.
You mean they don't have public health contact tracer?
Not enough. They have a few at CDC and at local government. They don't have a pejabat kesihatan per se.
Oh, I see.
In their whole system in the US. You see, we are following UK system where we have district health office.
Okay.
Even the UK is very limited. District health officers are very limited, and they are overwhelmed actually. So they have to hire actually contact tracers to do the job. Here we are able to mobilize many staff from our district health officers to actually do the contact tracing. So another thing that we're involved with, of course, is a vector-borne disease, dengue, as you may know. Fogging. Everybody remembers fogging, but actually fogging is not the main thing to control dengue. Did I remind you all again?
Okay.
The main is actually source reduction, mosquito breeding. Not
I see. Okay.
killing the adult mosquito. Fogging actually only kills the adult mosquito. The main control efforts that we try to implement and try to teach the people is actually reduce the source of breeding.
Okay.
So another thing we do, of course, if we run all these health programs, outreach programs to the community, mobile health services, helicopter flying doctor services in Sarawak and Sabah. And then sometimes when we go off-road, things happen, like we have a tire puncture, we have to change. And this video here shows one day when I was doing this field work, there was a landslide covering the road. So we had to dig away part of the landslide. And it's really very close to a ravine, quite a high ravine. Of course, I got out of the car to film it. I'm too afraid to be in the car.
So you walk along the ravine.
I didn't get in the car. So
Okay.
So I filmed this on the driver inched close to the ravine and got through that landslide. That was a scary moment for me.
So part of the public health physician in the field is rural areas to visit.
Yes, we do lead teams to do treatment, to do investigation. For example, cases like leptospirosis, malaria, and that we sometimes have to go down to investigate and lead the control efforts. So these are our pictures of some rural clinics in Sarawak and Sabah, also the same. This is the rural clinic. Some are very far in the interior. We have to take a boat to reach. And during one of these, my trips, it was a very scary, I would say grade 2 to grade 3 rapids. For those of you who go whitewater rafting.
Yes. Very interesting, your job.
Yeah, so this is a video of the one I took. There's a bit of you can see here the rapids coming up. I was actually afraid of getting wet, so I hide my phone for a little while while filming.
Yes.
Yeah, I can see very choppy waters. So that's part of the interesting things that we do. Besides that, of course, as you know, we enforce public health laws. The Food Act and Food Hygiene Regulations are under the public health section. For example, we close restaurants or dirty eateries, even McDonald's we have closed because of unhygienic practices. We are also in charge of this CDC Act. I'm sure everybody knows what is EMCO, MCO, CMCO. So these are all under the CDC Act. And finally is the DDBIA, which is the Destruction of Disease-Bearing Insects Act, where if you ever get compounded for having a larvae in your house, that's under the DDBIA.
I see.
Yeah, so these are also under the public health section. And lastly, of course, public health is everywhere. Not just a cushy office hour job, as most people think. We all administrators, we stay in the office. So public health physicians are in the field, not just in the office. So just wanted to highlight that. So let's go forward to what is the pathway to a public health specialty in Malaysia. So this timeline just gives a overall picture of what is the pathway. You start off as at your third year medical officer. You have to do a pre-specialty training, have a logbook, and of course you need to complete 2 years before you can join this pre-specialty training and get attached to any district health office for about 6 months or any public health section for about 6 months to complete your logbook. And you have to sit this MedX, basic public health medicine test, that is valid for 2 years. And then you submit your application and you enter into the interviews process before you enter into if you're selected, you go into the local university. And you will have to go through 1 year of MPH, Master of Public Health, and 3 years of Doctorate in Public Health. When you graduate from these 4 years, then you go through a gazetteman process of 6 months. And then you will, if you pass the gazetteman process, you will be gazetted as a public health medicine specialist. So that's the overall pathway. Maybe I'll go through one by one. What is all this? So the basic public health MedX. MedX actually started just 2019. The conjoined board of universities, local universities, decided that all applications to local universities must go through this MedX. For public health also, basic public health medicine test. For public health, it covers 5 disciplines of public health: epidemiology, policy, occupation, environment, family health, and biostatistics. These are the 5 topics that will come up in the exam. So you have to pay some money for it, 350 ringgit, and it's valid for 2 years if you pass.
So this is actually just an exam to try to enter into your master's program?
Yes, this is for all master program in Malaysia at this time. Even
I see. For all
internal, for surgery, they have their own test. Internal medicine, all that will have their own test now. So it's called MedX, medical examination. It's a standard now since 2019. So this is the latest. Okay, so for public health, we want you to have a pre-public health specialty training. The condition for this logbook is that you must be at least completed 2 years as a medical officer without interruption. And then you have to serve 6 months in any public health section or unit to complete this logbook. You need a mentor to sign off. This mentor must be 4 years at least a senior specialist of at least 4 years seniority to sign your logbook. And this logbook covers 7 modules: health management, disease control, family health, etc. So you can download this logbook from KKM website actually. And you apply to attachment to any of these public health section. For example, you can apply if you are in a hospital. You can write a letter, you want to via your pengarah to the pejabat kesihatan, say you want to attach for 6 months to complete your logbook. Then we can actually arrange you to come in, maybe alternate week or so, to complete the 6 months in the pejabat kesihatan, so that you can complete the logbook. Because this logbook is now compulsory before you can be accepted for interview. You must complete that. So for interviews, now for the past few years, it's now a combined interview organized by the conjoint board, where all the local universities lecturers will combine to become interviewers. So there will be interviewers from the main local universities. When you apply through KKM to join public health, if you pass your MedX basic medical exam and you are a suitable candidate, you may be called for interviews. So last year, there were 200 plus candidates for 80 places in local U's. So some of the local U's that offer public health masters is UNIMAS, UKM, UPM, USM. And UMS only offers up to master level. They haven't started offering the doctorate yet. So
Where's
you have
UMS? What is UM?
Sabah.
Oh, Sabah. Okay.
Yeah. So that's for local universities. And the Master Public Health is a 1-year course. It covers all the core competencies. You have to submit a master's thesis within that 1 year. You have to do your data collection, research, everything, and submit the master's thesis within that 1 year of your first year of your master's. And you need a B+ average to get into the DRPH program. Mainly, it covers basic research methods for that 1 year Master of Public Health.
What if you don't pass to go into the doctorate and you just have your master's?
Then there is a parallel pathway.
I see. Okay.
So the DRPH will be a professional degree. It's called a doctorate in public health. You have to produce and submit a thesis, and you'll have to go through a thesis defense. Some universities have a final professional exam as well. You are supposed to have a publication in any peer-reviewed journals. It doesn't have to be ISI, high impact factor, whatever. As long as it's peer-reviewed journals, I think most universities accept it. It covers advanced public health competencies as well as statistics, and gives you a very strong research foundation because it's a doctorate thesis, equivalent to a PhD. And finally, after you pass, you will be posted to do your gazetteman, and that is a 4 years. And this gazetteman process, they recognize those who had Masters of Public Health, the 4-year course, before 2014, and those Master of Public Health 1-year master before the year 2000. Then you can get you can be gazetted as a public health specialist. Those senior ones, yeah, those senior ones, they only had 1-year master before the year 2000. Then they can also be gazetted.
Oh, I see. Okay, okay.
Before those, they graduated before the year 2000. But those who graduate with 1-year master after the year 2000, they cannot be gazetted as a public health specialist. It's a parallel pathway. Later I'll explain. Okay. So the 4-year course master last time Master of Public Health was a 4-year course, and from 2015 onwards, they changed to a 1+3, the master and the RPH. So those graduated before 2014 are still accepted for gazetteman. So, okay, these are the recognized universities that allows you to come back and you can apply for gazetteman as a public health specialist with the Ministry of Health. Of course, the main local universities, but it also lists some of the more prestigious universities all over the world. So some people have actually gone by themselves to to study for this doctorate, or some have got government scholarships to go there,
Oh,
John Hopkins, etc. So they can be accepted as public health specialists. So gazetteman, basically, you will have to be gazetted under 2 public health specialists, senior public health specialists, one as a technical and one as administrative assessor. A minimum of 6 months. You have to submit another logbook.
this is
A world of logbooks.
yes.
So if you're approved, you will be published in the Federal Gazette as a public health specialist. So this is an example of a gazette, yellow color. So, and after that, you will have to register compulsorily with this National Specialist Registry. You need 2 referees. You have to pay 1K or 1.5K now, if I'm not mistaken. Another 500 for administrative fee. Right, and the CDPD points will be different for normal compared to normal MOs. Okay, subspecialty for public health is not established yet formally, but these are the main areas that have subspecialists. We call them the grandfathers and grandmothers. They are what do you call it? Recognized as a subspecialist by the NSR, National Specialist Registry. So far, the most formalized subspecialty is epidemiology. We have what we call the EIP, Epidemic Intelligence Program. And if you pass that and you have an attachment with one of the lead agencies, after many years, 4 years, you can be registered as a subspecialist at NSR. So that is, epidemiology is the most formalized program for subspecialty for public health. The rest are not formalized yet. You can work in that unit, and after 4 to 5 years, you can apply for subspecialty with the support of the referee, of course. But it's not formal training yet. All these environmental health, NCD, etc., not formalized, but it's there. So these are and the parallel pathway itself is also not formalized. The accepted practice now is if you have only MPH after the year 2000, or you have a DRPH from a non-recognized university in that list just now,
Okay.
you need at least 8 years of working experience in public health, and you need to submit a paper and report to the Public Health Authority. In KKM, we have a bahagian perkembangan perubatan. Kesihatan awam. Perubatan is for hospital. Bahagian perkembangan kesihatan awam that will accept whether you can be gazetted or not. They have to approve. So they want at least 8 years working in the field. If you have a master's on a non-DRPH from recognized this one non-recognized university. So this is the parallel pathway for public health.
This is a long pathway.
Yes, yes. 8 years.
And not assured, not assured.
Not assured. So career prospect, of course, after 5 years as a pakar, you will be promoted to UD 56. And the highest grade for public health specialist is Director General, of course. He is a Turus 3. Of course, currently, Dr. Hisham is not a public health specialist, but there have been the previous DG like Dr. Hassan last time was a public health physician. So there have been many public health physicians who have gone up to the grade of Director General. So that's the highest you can go as a public health medicine specialist. Of course, limited practice in private. You can do hospital management. Some end up as occupational health consultant, environmental health consultant also, and lecturing, of course. No big money, as I mentioned here. But it's basically a lifetime of service.
Yes.
And only a life worth, a life lived in service is worth living, according to Albert Einstein. So I think with that, I end my presentation.
Okay, thank you very
Any
much.
questions?
Okay, so we have we want to open the floor for questions now, but we have a comment from Chandrika. She says that she's recently placed in KLIA as a medical officer. Happened to be the SOP are frequently changing. Example was